Hey guys, this is Dr. Laney again, and today's video is a little different than most. This is, I hope, a heartfelt and helpful video for students who wish to become a physician or who are already in medical school and are trying to decide whether or not they want to do pediatrics. So first of all, remember when you're on any given rotation, I want you to throw yourself into that rotation and really convince yourself this is what you're going to do. So when you're on OBGYN, you just plan to become one. When you're on family medicine, plan to become one. You see what I mean? Psychiatry, surgery, hospital, inpatient, outpatient. Definitely when you're on pediatrics, just imagine you are the pediatrician. And if this could motivate you to get up every morning and to enjoy your career and enjoy life. So when I make a decision, I often make a list of pros and a list of cons. So I've decided to do that for you guys who are trying to decide whether or not to pursue pediatrics as your career. So the number one plus for pediatrics, the patients. They're adorable. They're sometimes tiny. They're always cute. Absolutely always cute. They are always deserving of your best. Nothing that happens to them is their fault. Now, this gets a little bit questionable in some of the older adolescents, but for the bulk of pediatrics, you are not going to be dealing with cirrhosis of the liver from an addiction to alcohol. You're not going to be dealing with lung cancer from an addiction to nicotine. They're just easy to love, these little guys. And so the number one reason to choose pediatrics is the patients. Their body fluids are less objectionable. If you think about emesis in a baby, emesis in a full-grown adult, I'm going with baby. Same for sputum, mucus, urine, poop, all better in the baby. So if it's a matter of body fluid selection, pick pediatrics. If you want to have a long-term relationship with the family, the parents, you get to know these babies so well when they're a brand new newborn. And I always joke that the people that listen the most closely to my advice are parents of first babies. And they've never done this before, and they really value what I have to say and my advice, and I love that. And so having this long-term relationship with the family and just coming alongside them and helping them, I love it. And you're only going to get that in pediatrics. Think about the difference you could make in this patient's life over the entire lifespan. Any intervention, any save, any amazing diagnosis that you could do could have the most impact as far as life years, because their entire life is still ahead of them. And that's pretty cool. A huge part of preventive care that we do is using vaccines. We love vaccines. Pediatricians are practically vaccine experts. We know how important they are. We know how valuable, effective, and safe they are. So that's a huge way that we as pediatricians are really a part of public health in general. And I love that because we can provide safe, effective vaccines that can save these children's lives. It's a pretty incredible thing. We often work with very kind people. If you had to stereotype pediatrics, we are obsessed with safety. True, I'll give you that. And that's kind of cool too. We love vaccines. We talked about that. And most of the time, if you're going to stereotype, we're just really nice people who love children and care about children's causes and want to help children, all children. And so it's usually kind of nice that the friends you'll make in your jobs are pretty nice, cool people too. So if you had to stereotype, there are some pretty hilarious ones. And I love Dr. Glockum Flocken, who's a TikTok and YouTube personality, because he so nails it for pediatrics. It's just true. But that's kind of fun if all of your colleagues are also nice people, genuinely kind, nice people. I love that. You rarely have to wear your white coat. So children do often have white coat syndrome. This idea, not always, this varies, but a lot of kids will get more nervous. To be perfectly honest, the 18-monthers are going to hate you no matter what you're wearing, really. And most of them who are terrified of you, they know when their mom or dad are pulling into the parking lot of your office that that's where they are, and they're terrified from the get-go. But still, so the way I approach white coat is if I'm cold and the AC's turned up too much in the office, I'll wear my white coat. Or if I need it, if I'm seeing outside patients maybe and I need more pockets, I might use it. But white coats are relatively optional in pediatrics. Now, I cannot promise this to you every time, but in general, pediatric patients are going to be less complex than most adult patients. Obviously, that's not always true. We get some extraordinarily complex babies who are being discharged from the neonatal intensive care unit. Some of those are still on oxygen. Some of those have congenital heart disease. They may be on Lasix. Some of those are on a lot of breathing treatments, all manner of complexities. Some of them may have a G-tube. Some of them may have a trach. And then those same patients over time remain pretty complex or become even more complex. They may have overwhelming developmental delay. They may have neuromuscular disorders, seizure disorders. There are all kind of things kids can have that are extremely complicated. It's just that on average, the complexity of peds patients is generally better than that of adult patients. Now, I don't want you to think that peds is just all boring and all we do is see runny noses. Well, obviously, you could tell in the pandemic, definitely not boring anymore when we in the very office have to often rule out or in if they have RSV, flu, or COVID. Things are much more complicated now, but they were never that simple. It's more complicated than maybe some adult physicians give us credit for. I don't know. And we, in general, have to deal with the death of our patients less often than adult physicians, and I am very grateful for that. So altogether, pediatrics is fantastic with kind colleagues, wonderful families, precious, precious, adorable babies that you get to watch grow up. You get to protect, you get to provide anticipatory guidance to the family so they can keep their babies safe and healthy and growing well. And it's just altogether wholesome and rewarding and a reason to get out of the bed and give it your absolute best all day long. Now, my list for cons is much shorter, but I will try to be just as honest as I was with all the good stuff. Probably one of my trickiest things to deal with in my career that has left me the most scarred, maybe that's a fair way to put it, are cases of abuse. And those are the times when you're not in a happy relationship with the family of the child. Most of the time you are, but obviously in these abuse cases you are not. And some of the cases that I've had have been absolutely heart-wrenching. And this is all a matter of public record, but a baby that I reported over and over and over and notified Child Protective Services over and over and over. And then they had the nerve to subpoena me to the mom's trial when the baby was found dead, floating in the bathtub at the hands of her high boyfriend, I'm sure, as was she. And that poor baby was not fed. It was malnourished. There were so many concerns I had. Lots of probably opioid use disorder in the parents. I'm not sure. But lots of abuse and neglect. And that's the part I saw and that's the part I reported. And very often, for many reasons, including poor resources in poor counties, things are not done as quickly as I wish or in the way that I wish they would be done. And many small, poor counties have foster care systems that are overrun and there are more children to place than there are homes to receive them. And it is just a sad, sad, sad situation. And, you know, we pediatricians pride ourselves on being advocates for children. And I need to tell you about my extreme advocacy case sometimes, when we were in the heat of the COVID masking debates. But it can be rough, some of these advocacy attempts. And when it comes to getting a child out of an unsafe situation, I feel that's where we really rise to the occasion and we always report it and we always try to get them to a safe spot. It just isn't always effective, and that's the part that crushes your soul. So I would say the abuse cases, probably my least favorite thing in pediatrics. With cerumen being a close second. I'm just kidding. I hate earwax. It's the bane of my existence. All I do, I feel like, is hold down babies kicking and screaming so I can scoop the wax out of their ears. Even though it's normal, as you will learn on my earwax video, please see that. It's just in my way when I need to visualize their tympanic membrane or eardrum. So, other things, even though I mentioned to you that we deal with death less often, and that is, thank the good Lord, true, when it does happen, and it does happen, it's horrendous. And I have been to several funerals, and I could tell you about every single one of them in every detail. I have diagnosed leukemia several times, and I could tell you about every single one of them and every single detail. Probably the most recent case that I diagnosed has been a few years ago, but I knew it before I even got the CBC, the complete blood count. When the little girl was on the exam table and I was examining her, and she was obviously pale, obviously had bruises and petechiae, and I went to do her abdominal exam, and I could feel both her liver and her spleen were so enlarged and so distended that they went all the way from just beneath the costal margins, liver on the right, spleen on the left, all the way down to the anterior iliac crest. Her abdomen was filled with organ and the liver and spleen that were so distended from leukemic infiltrate. But when I did get the CBC and went back into the room to tell the family, I think they already suspected it was something pretty bad, and they could probably see the look on my face. And I will never forget her father, who was so professional and so stoic and so serious looking, even before all this had happened. Tears, just streams of tears were running down his face, because I think he knew even before I could put it into words, it was something really, really, really bad, and it was. And so dealing with leukemia, childhood cancers, and obviously death, the worst part of pediatrics. And by the way, childhood cancers do not get enough research and enough grant and funding money to fund all the research that needs to happen. Many of the childhood leukemia agents have been around for 40 or 50 years. There's nothing new because nothing new has been developed. It's heart-wrenching. It's wrong. It's ridiculous. I have a friend who's because her son had leukemia, is a huge advocate for pediatric cancer research. And that's a big deal too, and that's a place that could use a lot of advocacy. Now, sometimes a problem in pediatrics is the parents. Most of them are wonderful, and I have such a sweet long-term relationship with so many patients' parents. They're genuinely my friends. But obviously, through the years, you're going to run into some difficult cases who don't know the history, who don't treat their child properly, who don't do things the way we know they ought to be done, who just don't have common sense sometimes, and it just rattles you. So sometimes dealing with parents is one of the most difficult parts. Now, I don't mind to some extent a fast-paced clinic, and most all pediatric clinics are going to be fast-paced. And sometimes that can be a little exhausting and overwhelming in peds. We typically schedule patients more frequently than adult patients would. And most of the time we can get away with it because they are usually less complex. But then sometimes they could be having suicidal thoughts, and it's really extremely tough, hard to get through the visit, but also very slow, and it clogs up the clinic when you've been booking them and packing them in there, and then you realize, you got a really complicated long one. Now, another one, and this shouldn't really matter, and yet sometimes in real life it does, so I'm just going to be honest with you medical students who are considering pediatrics. Pediatrics is paid the least of all the medical areas. And that's unfortunate. I think even it has nothing to do with the IQ or the skill or the compassion level of those of us who choose to go into pediatrics. I could even probably argue the opposite sometimes. But it does have to do, I think, with just the amount of value our society places on children. So even, it's not just that peds is a primary care specialty, which often, is less compensated. Because you could look at a pediatric cardiologist versus an adult cardiologist. Peds cardiologist is, makes less. Peds endocrine, adult endocrine, on and on and on and on. It's always that the peds subspecialists are reimbursed at lower rates than the adult subspecialist. And so certainly you would not choose pediatrics because you could be rich or make a lot of money. That is just not how it works. We often work long hours because we don't want to say no to somebody who calls in sick at the last minute. And for children, they get sick fast and they get better fast. And we don't want to share them with urgent care or emergency room who may not, especially in smaller, under-resourced areas, have the skills that they need to deal with some pediatric issues. Other issues are if you are in a very rural area, pediatrics as an entire specialty has not evolved in the same way that adult medicine has. In adult medicine, very often you get to pick, even in rural areas now, between being an outpatient doc and an inpatient doc. But for peds, very many times, almost always in smaller communities, the pediatrician has to both see patients outpatient and still cover the newborn nursery and some often extremely complex emergency delivery room situations and cover inpatient peds if they have them in that small community hospital. And so, and you know, the delivery room for us pediatricians is the highest malpractice area, what is the scariest for us because it has the most liability. And so these guys who are still doing more old-fashioned medicine as far as work all day, work all night, work all day, and that's not typically how it happens. So that can introduce some work-life balance concerns for people considering pediatrics. And I don't want to tell you to not go to those areas. They need you. It's just you need to be careful when you're looking, when you're signing your contracts, looking at non-compete clauses and various tricky things that people often forget to teach you in medical school. You need to remember that peds is different in rural areas than it is in the big city, where there are neonatologists to cover the nursery and inpatient hospitalists for peds in the big city, just like with adults, but not in rural areas. So guys, those are a lot of details. If you're not agonizing over this decision, I probably already lost you. But for any students who have asked me that question, and there are a lot of students who have, I hope that was helpful, you guys. It was completely honest, not very scripted other than my list here of pros and cons. Please ask me questions. I'm available for that if you have them. Thanks.